this talk is the power of the pull-up. However, it also includes the row, just like horizontal pulling. Horizontal pulling actually comes at much more of a premium than overhead as far as like the amount of time you want to dedicate your program to. Here, let me show you why. So we look at the slide here of the shoulder, and when we do a horizontal row, well, just basing on pull in general, our body is much more capable of pulling, creating a pulling action than it is pushing. So like a shoulder press or a bench press, our body is much more capable of doing like an overhead pull, and especially like a horizontal pull. There's a lot more shoulder muscles that are involved with the pull, and they also, when we train pulling, it also helps with our posture, especially a lot of different row variations. But this complex right here in the shoulder, right? So you have the medial and lower trap complex, both rhomboids, posterior delt, the lat, and especially the short head of the lat that are working, and they kind of sit that retraction and depression position in the shoulder, which I think I mentioned this again, like I said in lecture, but when we sit all day, we're doing it, we look forward and everything's like hunched forward. So when we do pulling variations, those can actually train us to get our shoulders to kind of like get into like a better posture position, right? So we can actually like train our shoulder. Like if we pull in our programs, like it forces us to kind of get up taller, and it helps with thoracic extension, but also retraction, depression of the shoulders, which is the opposite of how we sit most of the day. So every time I'm giving somebody a program, we're either rowing every day, but we're for sure pulling in the programs that I give people. So again, kind of have you seen with the squat and with the hinge, and when we were talking about assessing people, when we're going through any program, obviously we want to clear somebody and make sure that we assess them first. So part of that when we're looking at pulling is rotator cuff stability, mobility to an extent, but it's really just this for like our active shoulder range of motion. We're looking at the total active shoulder range of motion here, and this is the one that you and I did. We did this with the FMS, and it's just that combined shoulder range of motion. And I think the biggest thing that we're looking for, and again, remember you're looking for that one hand length, but the biggest part is if there's a huge discrepancy, right? So if somebody's like a 2 or 3 on one side and they're a 1 on the other side, obviously you're going to have to do some of these other drills that we're going to go over to get mobility back and then start feeding in stability. Because if they can't even get overhead without compensating, obviously they can hurt themselves, especially in the pull-up. Not so much the rows you can almost do all day. You can butcher that exercise too, but you're not going to it doesn't come as much of a premium as far as the toll it's going to take on your shoulder, like doing rows over and over again. So the total active shoulder range of motion screen from the FMS is a great way to kind of see if somebody has balanced range of motion on both sides of the shoulder. From there, we're going to go ahead and we can work, like I said, some mobility stuff. One of the things that, again, when we were talking about the joint by joint approach, where we're looking at, the body as a kinetic chain of mobile and stable joints, right? So the ankle is going to be mobile, knee stable, hip mobile, low back stable. So then our upper back has to be mobile so that we can extend, and then we can allow the shoulders to kind of slide, rotate up and down on the rib cage. So one of the big things that we want to do to check back mobility is the rolling
Your arms are
patterns.
up over your head.
And so just like this gentleman's doing, you go completely prone on the floor. And what we're doing here is starting with the arm and the shoulder. Let me pause it. So we're trying to keep this hip flat to the ground. So the only thing that's actually moving here are kind of the T-spine, muscles in the T-spine and in the back of the posterior shoulder. So if you can see, he's kind of like, his hips are pretty flat, his legs are relaxed. So he's actually moving only through the upper extremity. So this is through the SFMA, which is more of a clinical screening tool, upper extremity rolling patterns. So this shows that the muscles in the back are at least strong enough so that they can rotate and be able to move through. And there's another one where we go from prone or from supine to prone, but especially if you're looking at somebody's ability to like thoracically extend under control, that prone to supine rolling pattern is huge. And then the last one we want to look at from a screen is, let's see whose video this is. Oh no, let me go here. It's a quadruped T-spine rotation. So yeah, come into a quadruped position, knees anchored in between, or elbows anchored in between the knees, and then we're looking at, can this individual, Erin here is a really good, she's extremely mobile, and so she's at almost like a 90 degrees of rotation right there. What you're just looking at is if it's about 45 minimum. So can you see my mouse, my stylus? So right there is about the minimum where you want somebody to be able to rotate to. And just like the controlled shoulder range, shoulder screen that we looked at from the FMS, you're looking for a discrepancy from one side to the other as well. So those are kind of your screens. You want to make sure that the upper back integrity is efficient before working the pull-up specifically, just because that can also lead to shoulder impingements, neck pain, other shoulder pathophysiological issues. All right. So then we're talking about resetting. So how to actually fix somebody's overhead position when we're talking about building a pulling program. So if they don't have mobility and they can't perform like a full overhead position and like hang, like they can't get full extension through the shoulder, posterior rotator cuff smash. This one's all on. So what we're looking at is like let's see if we can see it on this individual. So posterior shoulder, it's a horrible view though. See the ball? So there's balls there, and it's mainly anywhere from where kind of the rotator cuff inserts the posterior delt, and that's just allowing. So it's like they have your lats there too. So if we can loosen this up, it just allows so that shoulder can just kind of get into full extension overhead. So that's for the shoulder SMR. This is a soft tissue self-myofascial release for the T-spine for the upper back. And so on this one, let's see. See the peanut? So this dude's doing little isolated kind of joint by joint SMR soft tissue release on the kind of like the smaller muscles actually in the thoracic spine. So you see he kind of does like a small rotation. He does a little bit of crunching forward and back. Notice the hips stay down, so he's not moving through his lumbar spine. All the motion's happening right above where the ball is, so he's mainly isolating those muscles and moving the shoulder, doing like an active release. So that's more for the tissue of the upper back. So if somebody can't do a rolling pattern, like if they go to roll and they like get stuck, they all of a sudden like can't open up anymore, this is a good one to do. Get a small, you can use a lacrosse ball too, it's just more uncomfortable. The peanut's cool because you can like really tack it right on either side of like the spine itself, and then work both muscles on either side. And then you can kind of do what he's doing, rotate and then extend, and then really loosen up that tissue that's in the thoracic spine. And then activation. So that's kind of soft tissue stuff just to release. If we're looking for motor control to get muscles turned on, that's some of these exercises. So this is a huge one. Pretty self-explanatory. Obviously, he's creating length through the lat and even the tricep a little bit here, hinging back and then passively opening up under the shoulder here. So this is just like an overhead lat reach stretch. One thing you can do with this exercise as well is put a dowel right here in the forearms. So they hold here and then they drop down. And then what that's going to do is going to keep external rotation in the shoulders as well. So it's going to help open up all the way, lengthen, and you're not going to be able to bias and drop through like this when you sink down and hide some of the stiffness that might be in the posterior shoulder and under the arm. So that's just kind of like a lat lengthening overhead exercise. This is a good one for actually like turning on the posterior chain in the upper body. So that is, your feet don't need to be up like this. But do make sure that, remember like when the guy was doing the T-spine drill with the ball in that other video, how he's staying like flat with his hips. So again, we want to stay flat. So one thing this guy is doing, you can actually put your feet up on like a box or something. And then what he's really trying to do is just make sure that as he's lying supine, he's like retracting the shoulders right here. And then he's sliding up and down with the shoulder blades engaged. So the shoulder blades are retracted, then pressed, and then he's working upward and downward rotation through his shoulders. Try that sometimes actually, like anytime you do like an overhead drill, like even a whole overhead shoulder pressing, it actually gets pretty tiring. It's a good drill. And then some more activation patterns. The rolling pattern that we went over that I showed you for an assessment, this is an activation drill as well. So this is like, you can do this to warm up for pulling, where you can literally just go prone on the floor. And like this is a good drill if like you guys are ever working out and you like want to warm up your back. That's a really good one to do. Aaron does a really good job of segmenting it in this video. And then band assisted. So this is if somebody's like, you're really trying to open up T-spine and they're like they're just tight. This drill right here, so you can actually use a band it around the shoulder a little bit. And so you can actually put your arm through the band, take a kneeling position, and then the band will actually help assist pull you open. All right, so that's our screens. These are kind of our interventions. And then here's the pulling continuum. So just like how the squat and the hinge had their kind of progression from like easiest to hardest, here's kind of what I've, through, again, a little bit of research, a lot of practical experience, what I found from a pain or a difficulty tolerance standpoint to a difficulty of execution, how I've kind of labeled out and how I progress people through pulling patterns. So horizontal row, inverted row, an elevated row, pull downs. We won't cover that too much, but then we get pulls that moves us into the TRX pull-up progression, assisted pull-up progression, and then strict pull-ups. So right here, this is like a TRX inverted row. And so this is pretty, I mean, this is just the regular row pattern. This one's awesome because it encourages who we work with, that they can really kind of come up tall. There's not a lot of load in this position because you're still standing upright. But again, the big point here is always to press and retract the shoulders to the top. So, right, make sure they're not squeezing their neck up, right? We don't want them using the trap to help pull up. In the inverted the vertical row, this is a really good place to start working and cueing people, kind of like getting that retraction and depression of the shoulders when they're actually pulling. And this is kind of a high amount of volume that we want somebody to be able to tolerate before we progress them. So it's 15 to 20 repetitions of good form in this variation, and then we can move them on. And this is when we come to an actual like the horizontal row. And it's similar except for the fact that now the individual is completely underneath the TRX. They are obviously holding more of their body weight, and it's much tougher to achieve that position. Same with the shoulders retracted and depressed, and they're not using their neck too much when they're pulling. There we go. There we go. So in this variation, so you see how this individual's legs are bent? If he just straightens his legs out, it becomes tougher. Because now his feet, if we're talking about biomechanics again, have moved further away from his center of gravity, which is still his belly button, but now his basis of support is his arms hanging from above, as well as the feet being further away. So the longer that base of support gets, the harder it's going to be to control, so we can make that more difficult. I have individuals go from this tabletop position, like completely underneath the TRX, for 10 perfect reps before going to a feet elevated variation. Which brings us to this one, and it's the same standards. We want the people that we're training, shoulders retracted, they're not elevating through the trap, and this is where they're just using a lot more of their body weight. So we've moved them up, so now a lot more of this weight, like there's a center of gravity, so we've actually pushed down into where the arms are going to have to hold more of our body weight. So it's the same variation, we're just now incorporating an inverted row, our foot elevated inverted row. And this kind of comes along the same continuum. Before we move somebody to like a TRX, like body weight pull-up progression, I like people to own this to a certain extent. So from here, so I'm not going to play this whole video for you. This is actually on TRX's site. It's about 3.5 minutes. I'm just going to go through the quick points. So we can take somebody in the TRX is overhead, and we put it in what's called an over short position. So if you see this individual is now doing more of a pull-up because the orientation of his body is directly underneath the TRX. So yeah, that's a good view. See how it's a pull-up now? So the way that he's doing it with his knees bent and his feet under him, again, our feet are really close to where our center of gravity is, so it makes it easy to push right underneath it. In that variation, you see how he just moved his legs out long. So with his legs out long, now, right, his base of support is further from the center of gravity. If we're looking at biomechanics, now it's tougher. And they don't show in this one. So from this variation, what I'll have folks do is I'll have them lift one leg up. So that way, instead of using both feet on the ground, there's only one to help support them, right? So if there's only one leg, it makes it tougher because they have to use their arms more to pick themselves up. And then they go through like this variation I'm not huge on, because once people can do this, I just usually give them a pull-up. But he goes through a full body weight TRX pull-up. We're looking at the progression for the TRX pull-up. Both feet tucked in is our first variation, and then 1 foot long and one leg still bent, and then both feet out. And then we move to 1 foot off the ground, so they're only using one straight leg to help themselves do the pull-up. And when we're doing that variation, we look to have somebody do 10 strict TRX pull-ups, 10 strict TRX pull-ups from the single leg position before we really start trying to get them to progress into like strict pull-ups from the bar. So that's our last variation. So when we're looking at that, an active hang, by the way, is just when somebody's holding the bar and they're just hanging, but they're hanging like this. They're not like dangling from the rotator cuff. They're actually like holding retraction and depression. The shoulder joint is essentially like a golf ball and a golf tee. So when we move it, we're just telling that tee to orientate itself differently so that golf ball can move freely. If the tee can't elevate, right? So if we can't retract, right, and we can't retract and keep the and then everything else, upwardly tilt and then rotate the scaps up so that tee of the golf ball, that golf tee can't point up. The golf ball doesn't have room to move, and that's how we have shoulder joint issues. So that's why the FMR or the SMR, the screenings come first before you start progressing somebody through all these variations. So anyways, when I have somebody start doing the actual pull-up variation, I'll just have them hang. So can they hold that tuck position and hold it, right? And then from there, we have them jump, and then they do holds at the top position, right? So they'll jump up, hold their shin over the bar. So I'll play this video a little bit. It's a long video. It's a good video, but it's long. So what he has is a band right here. And I used to not be about bands, but now I've changed my view on that. I'll explain why in a second, but if you can see, so he has him just doing like a just a chin up hold, right? So chin up hold, great way. If you look, this guy is neck's relaxed, right? So he's still in scapular depression. He's still holding here in the pull up, right? He's not holding here, and he talks about this in the video. So I encourage you guys to go look at it when you have a chance. From there, you can start to use the band to help somebody come up, and then we start to do negatives. So you want somebody to actively hold for 30 seconds, come up once they can hold here for 10 seconds, chin up grip, it's a lot easier. Then we start working the negative. So you can give a band, they can jump up, and then they start going 3, 2, 1, all the way down, jump up, hold, 3, 2, 1, and then down 3, 2, 1. So we're building time under tension, not by the number of repetitions we're giving somebody, but by the amount of time that they're holding on the bar. We get somebody strong isometric, then we start working the eccentric, and then you can start working a band. Once somebody has the form down, you can have them use a band to actually just start doing more repetitions and get volume with the pull-up. So you may do that like as a really high CNS, like high stress on the lats and on the shoulder joint for that day in your program. And then maybe later on you do pull downs, like a pull down machine. I didn't mention those, but those are good too. You can still do the same thing. Pull down, hold, 3 second up. Or you do the band and you do higher volume. So one day would be more skill where they're doing maybe like 5 sets of 10-second holds or more, or like negatives, like 5 sets of like 5 negatives. And then the other day, maybe they're just doing regular pull downs or they're doing band pull-ups because it's less intensity, but we can up the volume, right? So one day intensity based, one day volume based. If we're looking at like a long program, we're trying to program the pull-up into something like the actual pull-up. Different variations. So negative, band. One thing on kipping, I'm not necessarily against it. I'll do kipping pull-ups, especially if I'm in a class and it's for time, and then there's that whole conversation about the quality of the movement. There's a lot of people that I know, and you guys might know as well, who can kip pull-up, but they can't do a normal pull-up. The reason they're doing that is they're using their entire body. So using their momentum of their body to dynamically, essentially they just create this giant fulcrum, and they use their body to essentially create an inverted row pattern, which gets them up over the bar. If they don't have that active like hold strength, right? If they can't do one strict pull-up, that tells me they don't have the strength in their rotator cuff to create that brachiation, that massive amount of swing with the shoulder being the main fulcrum point to hold their entire body. And so almost everybody I know that can't do a strict pull-up but does kipping pull-ups always ends up with shoulder issues, because they're essentially just hanging from the soft tissue and they're just using this like this winding mechanism and using this momentum and the catapulting their body as the ability to get up to the bar or up over the bar, if we're talking about muscle up. And so if they don't have that just base strength, right, when we're coming down to strength training, it's just movements. So even if somebody's doing a kipping pull-up, they need to still have this retracted position. I'll see people kip and they're just here and they just literally throw themselves up over the bar, and they get up over the bar. I'm like, you did a muscle up, you got over the bar, but how do your shoulders feel? Are you actually getting stronger from doing this? And I see a lot, like literally almost everybody I know that can't do a strict pull-up ends up hurting their shoulders doing kipping pull-ups. Because with a kipping pull-up, you're just using this huge stretch reflex from the lats, right? So I'm not against the kipping pull-up because you can get actually more volume than just a normal pull-up if you have the prerequisite strength to not hurt yourself. My goal, our goal as coaches or as a trainer, is to get somebody better, right? And minimize any possible negative outcome from their training. Like, you shouldn't have somebody leaving feeling worse than when they come to you. Oh, okay. So, and these are just goals that I put up there that I have a lot of people that I put out there. So for, if I have somebody, I'm like, this should be your goal. For men, an active hang. So that's just the hang. 1 minute, the hold. So chin up over the bar for 30 seconds, and then at least 5 strict pull-ups. Right. So no kip, chin over the bar. Pull-up is not chin up position, but like pull-up position. For women, it's 30 seconds on the active hold, 10 seconds here on like the full like isometric hold at the top, and then just 1 strict pull-up. And I know women that can do more than that. I know men who can do way more than that. I know men who can do less than that, and vice versa, everything in between. I'm just saying is like benchmarks for strength, more or less. Like if somebody can do this, that's a strong individual. Like somebody can like do a 1 minute pull-up hold, you're like, cool, your shoulders are strong, I could probably start doing a bunch of stuff with you, right? Just using that strength movement as like a clearance test.